Hi, I'm Ken Schaefer, and I'm here to discuss all things related to men's sexual health. And you may or may not know, but this is part of a regular series called The ABCs of Men's Sexual Health. And today we're up to the R's. Okay, so what is the R? The R is risk factors for each. Age is a risk factor. I think that's pretty obvious. The older you get, the more unhealthy you get, the more trouble you have producing hormones, other things start to go wrong, prostate issues. So, yes, age is definitely a risk factor. Chronic health conditions, that's a big one. So, a lot of people don't know it, but when you have ED, it's almost always a sign that something is going wrong in your body. Now, you may know exactly what it is. Maybe you have a chronic issue like diabetes or whatever, but you may not know what it is. And it may be something very subtle. And sometimes when men are experiencing ED and they go to their doctors, the doctors will run some tests. And if the tests come back normal, the doctors will tell them that they're fine and throw Viagra at them. Unfortunately, things aren't that simple with your body. Normal test results do not mean healthy test results because as a population, we are extremely unhealthy. So being unhealthy is normal. All right, so chronic health conditions. So if you have ED, there's a good chance that you have some kind of chronic problem that isn't going to go away unless you can find a doctor who is going to be willing to search for the underlying cause of your ED as opposed to just treating the symptoms. Lifestyle choices. Here in the United States, one of the reasons why we're so unhealthy is that we're eating really bad food. We're not eating enough vegetables, we're not eating enough fruits, we're eating way too much junk food, high glycemic carbs, unhealthy fats. We're not exercising enough. And that may sound strange to some people because we actually, as a population, exercise more than previous generations. But it's not as simple as do you work out? Exercise also includes what you do during your day. And during the day, we are more sedentary than ever before. And most people are not on a regular exercise program, so they're extremely sedentary. Medications. So, a lot of medications that are commonly used to treat all kinds of things, everything from depression to high cholesterol and a whole bunch of others, do have side effects that include erectile dysfunction. All right. So if you are on medications, you should dig in, use Dr. Google, Google your medications, and find out what the side effects are, and particularly if erectile dysfunction is associated with using this medication. Then, if it is, you need to discuss that with your doctor. Are there alternative medications? Are there supplements? Quite often, you can treat, rather than treat what's wrong with you with pharmaceuticals, supplements may be good enough and may even be better than the pharmaceuticals with far fewer side effects. Okay, psychological factors, emotional stress, pushing our dopamine buttons constantly, anxiety, depression, low self esteem, performance anxiety. These are all things that kind of fall under the umbrella of psychological factors. If your ED is psychological, then that's that's different from a physiological cause. I most commonly talk about physiological causes. If you have psychologically induced ED, then you need to see someone with psychological credentials. It's also important to know that they can play off of each other. You might have some slight physical ED, but you start having problems, it gets in your head, and then you have psychological factors playing off of the physical factors, making the physical factors worse. So, anyway, on to the next one, hormonal imbalances. Yeah, that's a very common one. For me, I had very low testosterone, although the doctors kept telling me I was fine. But it wasn't until I corrected my testosterone that I started to improve. I also had low thyroid hormones, which I was able to correct using supplements. There are many other hormones that can affect you, so just be aware that. And I'll go back to what I was saying earlier. Just because they're normal, just because your test results come back normal for a particular hormone, that does not mean your levels are healthy or optimal. Don't let your doctors get away with saying you're normal, everything's fine. That doesn't mean everything's fine. It just means that in an unhealthy population, you fall within the range of normal. Okay, injury or surgery that can often affect your vasculature and your blood flow, obesity and poor physical health. Well, that's kind of what we've been talking about, poor physical health in general. There is an obesity epidemic in the United States and in other Western countries. There's a lot of reasons for this, but the two primary reasons seem to be bad diet and endocrine disrupting hormones, EDCs. EDCs are all around us, and there is really some shocking data out there about how it's affecting our health. EDCs are estrogenic compounds, and they trick your body into believing that they are a form of estrogen. And the side effects of being exposed to these compounds are for men, ED, for men and women, infertility, and weight problem because they're estrogenic compounds, and estrogen is a hormone that will result in increased fat stores if your levels go too high. It's it's not difficult to make the connection between these EDCs and obesity, but you can't rule out diet. You know, people are eating a lot of junk food. They're not eating enough fruits and vegetables. I was saying this earlier. So those are the common risk factors. And I'll run through them real quick: age, chronic health conditions, lifestyle choices, medications and treatments, psychological factors, hormonal imbalances, injury or surgery, and obesity and poor physical health. But it's all related. And it's important to know that you can address almost all these issues. Obviously, you could receive an injury that's catastrophic and you can't really address that, but for the most part, these are addressable, usually with just lifestyle changes and avoiding endocrine disrupting hormones. Oh, and hormones, compounds, EDCs. And the way you avoid EDCs is get plastic out of your life as much as possible, particularly out of your kitchen and out of your bathroom. In your, you don't want to store your food in plastic. You don't want to cook your food in plastic. You don't want your personal care products stored in plastic if at all possible. And while I'm at it, I might as well tell you that a lot of personal care products are filled with a lot of toxic compounds, a lot of EDCs. So search for personal care products that are natural, not full of chemicals. All right, I think that's it. Thank you for watching, and until the next video, thanks for watching, and goodbye.